Taipei Medical University Hospital was established in 1976 and is located in Taipei, Taiwan, near the Taipei 101 building. Our hospital's gynecology department is committed to the advancement of minimally invasive surgical techniques. We began using the robotic surgical system in 2011 and have now accumulated over 1,500 cases. It has become the leading hospital choice for patients who consider undergoing robotic surgery. After being diagnosed with a gynecological disease that requires surgical intervention, your doctor will discuss the different options you have. Depending on your individual medical history, you may be a candidate to receive robotic surgery. Your doctor will first take a detailed medical history and perform a physical exam, and then may require blood tests or imaging tests to be done. When the preoperative evaluation has been completed and robotic surgery is considered, a consent form detailing the risks, benefits, and other treatment options will be presented. If you agree, you will be scheduled for admittance and surgery. Preoperative anesthesia assessment will also be done at the anesthesia counseling clinic before the surgery. Anesthesiologists will evaluate your individual condition and discuss intraoperative anesthesia and postoperative pain management options with you. On the day of admittance, our nursing and ward staff will help you complete registration and fill out any other forms concerning your medical treatment and surgery, including blood transfusion consent forms and other additional expenses. You'll be given a tour of the ward and facilities. We provide areas for food preparation and laundry washing machines. Our ward is also equipped with resuscitation carts for emergencies. You will then be given ward clothing to be worn on the day of your surgery. You will be given special instructions about further exams to be completed and diet restrictions the night before your surgery. On the day before your surgery, you will be instructed not to eat food or drink water. When it is time to go to the operating room, you will be pushed in your ward bed, and upon reaching the nursing station, your identity and surgical procedure will be confirmed. You will then be transferred to a different bed while waiting for your operating room to be prepared. Entering the operating room, your identity and surgical procedure will be confirmed again, and you will then be moved to the operating table. In the operating room, you can see the different areas for the anesthesia team and their monitors at the head of the operating table, the Da Vinci console at the far corner of the room, the Da Vinci tower and monitors at the side of the operating table, and the Da Vinci robot at the foot of the operating table. When preparing for anesthesia, your identity and surgical procedure will again be confirmed. You'll be given medication through an intravenous line to let you go to sleep. After you have fallen asleep, endotracheal intubation will be done. When anesthesia is complete, preventive measures such as leg stockings and additional intravenous lines will be placed. You will be set in dorsal lithotomy position with padded leg supports and both arms tucked in at the sides with sufficient padding. Your umbilicus and abdomen will be cleaned with a skin cleanser and then sterilized with iodine and alcohol. Your body will then be draped with sterilized cloth. After preparation and positioning has been completed, docking of the robot will begin. Robotic instruments are sterilized and packaged in the autoclaving room. They are then retrieved and placed on special trays in the sterile area. The different robotic instruments available include the fenestrated forceps, curved monopolar scissors, and etc. Depending on the surgery, 1 to 2 assistants and a scrub nurse are needed at the operating table during the surgery. The surgeon sits at the console in the far corner of the room and controls the robotic arms docked on the patient. After the surgery has been completed, the endotracheal tube will be removed and you will be given medications to let you wake up. You will then be transferred to a bed and taken to the recovery room. There, you will be monitored by our nursing staff and anesthesia doctors. Crash carts and ventilators are also available for use in case of emergencies. When you are more awake and alert, you will then be taken back to the ward. During your post-operative recovery, you will receive personalized and comprehensive care. We will teach you how to care for your wound and ways to manage post-operative pain. When your condition is stable and are able to eat regularly, you will be discharged home and outpatient follow-up will be arranged for you.